for the adults, the Ph-negative ALL, we have several factors to take into consideration to assess for the assessment risk factor. One important factor is age. As long as the age become older, the efficacy also outcome become poor. These are very important prognostic factors. Another important prognostic factors is the white blood cell count. If the blood cell count higher than 30,000 or 40,000, also is a marker for poor adverse prognosis. Also, we should consider the biological characteristic of the AL. That's including chromosome karyotype, such as 11q deletion. This is quite important for us to assessment for this kind of patient, especially if the patient carried 11q deletion. That means have the male rearrangement. This kind of patient, native patient, always have the poor prognosis. Another, as next generation or some new method, we can find other gene mutations, such as the JAK pathway or ABL pathway that identified. We can find another important category AL. We call this PH-like AL. If the patient with this kind of abnormalities, also means adverse outcome. Also important prognostic factors. Generally, we can find the patient age, white cell blood count, karyotype, specific gene mutation. Recently, another important thing we should take into consideration is we should see the treatment response. This is important for us. We can use the specific technology. That means we call this as MRD, measurable residual disease, that reflect the disease burden after treatment, especially after induction. Early response also quite important. If the MRD level become detectable or below the detection level, also associated with a favorable outcome. Otherwise, we can take this patient into the adverse risk categories.